Hi there, future teacher. Welcome to your study guide for the NES 813 Early Childhood Special Education Exam. This video is a refresher for the information you need to know to pass. We'll cover the exam format, then deep dive into two of the three domains: understanding young children with special needs and working in a collaborative learning community. Let's get started. Before we dive in, we put together a free study guide workbook that goes along with this video. It has all the key terms, practice questions, and space for your own notes. Grab your free copy from the link in the description. This video is presented by TeacherPreps.com, where we offer complete study guides, full-length timed practice tests, vocabulary exercises, and constructed response practice for dozens of teacher certification exams. It's free to get started. All right, that was our plug. For the rest of this video, it's go time. Grab your pen and paper. Let's start with the exam format. The NES 813 has 100 multiple-choice questions, and you get 2 hours and 15 minutes to complete them. That works out to about 81 seconds per question, so you have plenty of time to read each scenario carefully. There are no constructed response assignments on this exam, so it's all multiple choice. The official passing score is 220. The exam is divided into three content domains. Domain 1, Understanding Young Children with Special Needs, is worth 27%. Domain 2, Promoting Young Children's Growth and Development, is the biggest at 59%. And Domain 3, Working in a Collaborative Learning Community, is worth 14%. In this video, we'll deep dive into Domain 1 and Domain 3. Let's begin with Domain 1. Domain 1, Understanding Young Children with Special Needs. This domain is worth 27% of your exam and covers 6 competency areas. You need to understand typical child development, how disabilities affect development, learning processes, assessment procedures, and medical aspects of disabilities. Let's break these down. First, typical human growth and development. You need to know milestones across 5 domains: physical, communicative, cognitive, psychological, and social-emotional. By age 2, most children use 2-word phrases and walk independently. By age 4, they engage in cooperative play and follow multi-step directions. Jot this down. Development across these domains is interconnected. A delay in language often affects social development, and a physical disability can limit cognitive exploration. Also know the factors that influence development: environmental, genetic, health-related, economic, and linguistic. Next, the developmental significance of disabilities. A disability in one domain ripples into others. A child with a hearing impairment will show delays in expressive language, which then affects social interactions. A child with cerebral palsy may have age-appropriate cognitive abilities, but face significant physical barriers. The effective teacher focuses on individualized strategies that optimize capabilities rather than assuming global delays. Look for answers that emphasize strengths-based approaches. Now, learning processes. The foundational concept is that learning is an active, constructive process. Children build knowledge through exploration and play, not passive instruction. Know the major theories. Piaget's constructivism says children build schemas through assimilation and accommodation. Vygotsky's zone of proximal development is the gap between what a child can do independently and with support. Behaviorist approaches like reinforcement and shaping target-specific skills. When you see a question about learning, the best answer involves hands-on, child-directed exploration with appropriate scaffolding. Competency 4 focuses on how disabilities specifically affect learning. A child with an intellectual disability may need more repetitions and concrete materials to master a concept. A child with autism spectrum disorder may learn content quickly, but struggle with flexible thinking and transferring skills to new settings. A child with a visual impairment needs tactile and auditory alternatives. The key test-taking strategy here is to look for answers that describe individualized, responsive strategies that build on the child's existing capabilities. Avoid options that suggest a one-size-fits-all approach or that focus on what the child cannot do. Assessment procedures. Distinguish 3 types. Screening is a quick check to identify children who may need further evaluation. Diagnostic assessment is an in-depth evaluation of a disability's nature and extent. Response to intervention, or RTI, uses tiered support levels, and monitors progress. Key principles. Assessments must be non-discriminatory, accounting for cultural and linguistic differences. Multiple sources of information should inform every decision. Assessment data should directly guide instruction. On test day, the correct answer involves multiple measures and connecting results to instructional decisions. Finally, in Domain 1, medical aspects and physical management. No common syndromes like Fragile X, fetal alcohol spectrum disorder, and spina bifida. Emergency procedures are tested, especially seizure response. Stay calm, protect the child's head, time the seizure, do not restrain or place anything in the mouth. Assistive technology is also key. Augmentative and alternative communication devices, adaptive seating, switches for computer access, and environmental modifications that increase participation. Let's try a practice question for Domain 1. A 3-year-old child with a significant hearing impairment is enrolled in an inclusive preschool program. The child's teacher notices that the child avoids group play and often watches peers from a distance. Which action by the teacher would be most effective in supporting this child's development? A. Assign the child a peer buddy and provide structured cooperative activities with visual supports. B. Allow the child additional time to observe before expecting participation in group activities. C. Refer the child for a comprehensive behavioral assessment to determine the cause of withdrawal. D. Create a separate play area where the child can interact one-on-one with an aide. The best answer is A. The child's hearing impairment is likely creating a communication barrier that affects social engagement. A peer buddy paired with visual supports directly addresses the root cause by providing structured social opportunities with accommodations. Option B is passive and doesn't provide support. Option C treats a predictable communication barrier as a behavioral concern. Option D isolates the child from peers, which is the opposite of inclusion. Now let's move to Domain 3, working in a collaborative learning community. This domain is worth 14% of your exam and covers 5 competencies about partnerships. You need to know how to work with school staff, families, and community agencies. This is the professional collaboration side of early childhood special education. First, establishing school community partnerships. As a special education teacher, you work on multidisciplinary teams. Consultation means providing expert advice to general education teachers. Collaboration involves shared planning and decision-making. Co-taking means 2 teachers share instructional responsibility in the same classroom. RTI, or response to intervention, requires coordination between general and special education staff. You also need to know how to work within different program models. Home-based services for infants and toddlers, integrated classrooms where children with and without disabilities learn together, and self-contained classrooms for children who need intensive support. The effective special educator communicates clearly, respects colleagues' expertise, and coordinates services to avoid fragmented instruction. School-home partnerships. Families are essential partners. Use regular two-way communication in formats families prefer: phone calls, written notes, email, or home visits. Recognize barriers to participation: language differences, work schedules, transportation challenges, and cultural beliefs about disability. Families should be active participants in IEP and IFSB meetings, bringing irreplaceable knowledge about their child's strengths and needs. On test day, look for answers that position families as equal partners, not passive recipients of information. Community interactions. Early childhood special education doesn't happen in isolation. Teachers need to know community agencies and services that support young children with disabilities. Early intervention programs, therapy providers, medical specialists, and social services. Transitions are especially important. When a child moves from early intervention to preschool or from preschool to kindergarten, the teacher facilitates a smooth transition by sharing information, coordinating with receiving programs, and preparing the child and family. Building positive relationships with community institutions ensures continuity of services and comprehensive support. Professional requirements and the legal framework. Key laws. Section 504 prohibits discrimination based on disability. IDEA guarantees a free appropriate public education and requires IEPs. The ADA ensures access and accommodation. PL 99 to 457 extended services to infants and toddlers through IFSBs. Know the key processes: referral, evaluation, eligibility, IEP development, and due process rights. Teachers serve as advocates, resource persons, and evaluation team members. History and trends. The field evolved from excluding children with disabilities to including them. PL 94 to 142 in 1975 established the right to a free appropriate public education. Current trends. Early intervention emphasizes serving children as early as possible because the brain is most plastic in the first years. Universal design for learning provides multiple means of engagement, representation, and action. Evidence-based practices include positive behavior supports, multisensory instruction, and naturalistic teaching strategies. Practice question for Domain 3. During an IEP meeting for a 4-year-old child, the child's mother expresses concern that her son is not making progress in speech therapy. She feels the current goals are too easy. Which response by the special education teacher would be most appropriate? A. Acknowledge the mother's concern and collaboratively review the speech goals using recent assessment data to determine if adjustments are needed. B. Explain that the speech-language pathologist is the expert and the current goals are based on professional judgment. C. Suggest scheduling a separate meeting with the speech therapist to discuss the mother's concerns in a more appropriate setting. D. Assure the mother that progress in speech development takes time and recommend patience with the current approach. The best answer is A. The IEP meeting is the appropriate venue for reviewing and adjusting goals, and the mother is an equal partner in educational planning. Her concerns should be addressed with data, not dismissed. Option B positions the professional as the authority rather than treating the family as a partner. Option C delays action and implies the IEP meeting isn't the right place. Option D dismisses the concern without examining the data. Great work covering Domain 1 and Domain 3. But here's the thing. Together, those two domains are just 41% of your exam. You still need to master Domain 2, promoting young children's growth and development, which is worth 59%. That's the largest domain by far, covering learning environments, management strategies, language development, emergent literacy, cognitive development, and much more. Without Domain 2, you're walking into Test A with less than half the preparation you need. The complete study guide covering all 3 domains, plus full-length timed practice tests, is available right now at TeacherPreps.com. Link in the description.